We're going to get started here at 11 o'clock with the first case of Ebola contracted in the United States. The patient is a healthcare worker who was treating Ebola patient Thomas Duncan at a Dallas hospital. Well, tonight, officials with the Centers for Disease Control and Prevention are trying to figure out exactly how did that happen. Robert Lyle's joining us now with the latest development. Robert, I guess they do have some clues about that.
A few, as a matter of fact. The CDC is now saying that infected nurse was not on their watch list, and her infection may have been an inadvertent slip. But medical records suggest that those Dallas healthcare workers may have been exposed to the Ebola virus long before any took CDC precautions. This reverse 911 call.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus.
Awakened scores in East Dallas.
Freaked out.
Because they found not only Ebola notices at the front door, but fire trucks and biohazard barrels in the front yard.
We don't have a landline, so we didn't get a reverse 911 call.
I think they need to really look into it and figure out where that person's been.
They live next door to the nurse whose employer says had extensive contact with Thomas Duncan, the first man to die from Ebola in the U.S., infected at Texas Health Presbyterian Hospital, says the CDC, through some kind of breach in protocol.
Clearly, there was a breach in protocol. We have the ability to prevent the spread of Ebola by caring safely for patients.
Duncan's family released his medical records showing on September 28th he was admitted with projectile vomiting, explosive diarrhea, and a temperature of 103.1. On the 29th, Duncan asked a nurse to put him in a diaper. The next day, he was diagnosed with Ebola. That's when doctors and nurses traded gowns and scrubs for hazmat suits. Duncan died October 8th. 2 days later, the still unidentified nurse came down with a fever and drove herself to the ER. The National Nurses Union protested today, saying nurses aren't adequately trained on Ebola, but now actively blamed.
We have been asking our hospitals throughout the country to provide us with training that allows us to ask questions.
Now, right now, the only known way to contract Ebola is through direct contact with bodily fluids. Now, given all that we've seen, the CDC now says that it is possible in the coming days that more healthcare workers will come down with that possibly deadly virus.